Hello and welcome to another edition of Currently in Quincy. I'm Joe Catalano, and on today's program we will get an update on Social Security from Kentia Torres, who'll be joining us virtually in just a few minutes. First though, we take a look at the weather and the news for you. Currently in Quincy, sunshine with a few clouds out there at 68 degrees right now. That's about how it's going to stay today. Mix of sun and clouds with highs in the upper 60s. Those clouds increase this evening and temperatures drop into the mid-50s, and it looks like an unsettled weekend. Unfortunately, we've got showers that'll develop into a steadier rain by tomorrow afternoon. The high only around 60 degrees. The rain could be heavy at times tomorrow night with lows in the upper 50s and still kind of gray and damp. Off and on showers here on Sunday, and Monday looks gray as well right now with showers and daytime highs only in the mid-60s. So enjoy today. Partly sunny with a high of 68, which it is in Quincy right now. Checking out the news for you today, Quincy Mayor Thomas Koch wants to rezone the property that's currently occupied by Eastern Nazarene College to allow for the construction of 55 and over housing if the college ever closes. Now, Koch has introduced an ordinance that would amend the zoning of that property, calling it a preemptive strike. Mayor says the state's recent opening of a family welcome center and shelter for migrants at ENC made him think about the future of that property.
This is obviously a very residential neighborhood, and wouldn't want to see a developer come in and get crazy and something there if that day should come. So the idea was to create the 55 and over overlay district, therefore create if it should happen, some kind of a development that would respect the neighborhood, that would be geared toward our older folks in the community. You know, there's people that I know that they want to unload the house, but they have nowhere to go. You know, they'd rather go somewhere that they're comfortable with their age bracket. And we really don't have much of that in Quincy, and that's a challenge. So, you know, more folks that would do that frees up the bigger homes for families. It's kind of what the evolution usually is on the housing side. So it's very challenging right now all across the board with very little inventory up there for sale. So I think it controls the destiny of that property and sets the stage for something very positive should that day come.
Koch says if ENC ever does decide to leave, future development of that site could be done by the city, the college, private developer, or a combination. The property is currently zoned for mixed-use development. The City Council placed the request into the Ordinance Committee for further discussion. Quincy City Council is calling on the state to approve a program that councilors say would lead to lower energy prices for Quincy residents. The City Council has been waiting for over 3 years for the Department of Public Utilities to approve what's called a municipal aggregation program that would allow the city to shop for competitive energy prices and then offer lower rates to residents. Ward 2 City Councilor Anthony Andronico introduced a resolution this week calling on the state to provide an update on Quincy's application soon and also to approve the program.
In Boston, where they do have a municipal aggregation plan in place, they only had to pay 10.9 cents per kilowatt. So we're talking about a potential 70% reduction if the DPU was able to approve our municipal aggregation plan. And doing some further digging, since the beginning of 2022, the DPU has approved 19 new municipal aggregation plans across Massachusetts, and Quincy has not been one of them. And I think it's time that the DPU and the state give Quincy's application the review that it needs, and it's time for them to approve the city's application for municipal aggregation plans so that ratepayers within Quincy can actually see a reduction in their energy bills. And I think that going through another winter of potentially looking at another 40 cents per kilowatt during peak times is just unacceptable, especially when this body in the city has been working towards a plan to reduce costs for our residents.
Andronico's resolution was approved unanimously and sent to committee for further discussion. Quincy police asking for the public's help in identifying 3 people wanted for questioning in connection with a recent housebreak. Police say 2 men and a woman were captured on video shortly after a house was broken into on Howe's Neck at about 6 a.m. on September 7th. The men pictured here carrying a big screen television. The woman was carrying a cell phone. Police say the trio are innocent until found guilty. However, they want to talk to them in connection with that break-in. This is National Security Officer Week, and the Quincy Public Schools are thanking the school department's safety and security staff and the Quincy Police Department for the recent training exercises that took place in the school system. This past summer, officers conducted training exercises at the Point Webster Middle School and Quincy High School during non-operational hours. The school officials say these training exercises help officers learn the layout of the school buildings and infrastructure to better prepare them to respond effectively in the event of an actual emergency. Well, the new Yawkey Housing Resource Center on Broad Street in Quincy is getting ready to open later this fall. During a recent open house, Father Bill's and Mainspring's Executive Director John Yazwinski explained that the new center will be very different from the Father Bill's homeless shelter that it's replacing right across the street.
Come during the daytime, store your stuff here, take a shower, have a meal, go see the doctor and the nurse, and start to build a relationship, baby steps, and then to get them to maybe, it's not so bad, I should stay here, and then we can get them not just the shelter bed, but get them into housing. And we've seen it happen across the street, but this is going to give us that ability to really work well with people. Right. The big difference to this facility to that across the street at Father Bill's is this is going to be 24/7. So people aren't going to be kicked out in the morning, kind of roam the community. Maybe if they don't have any destination, they can stay here, and we'll have a lot of programming during the daytime.
That new $25 million resource center will include a 75-bed emergency shelter, 32 units of permanent housing, day services, a Manic Community Health Center clinic, and services to help people access services and find jobs. Another open house will be held there tomorrow from 10 a.m. to noon. The traveling exhibit about the terrorist attacks of September 11th, 2001 is at the General's Bridge and Park in Quincy Center through tomorrow. The nonprofit Tunnel to Towers Foundation's 9/11 Never Forget mobile exhibit arrived in Quincy on Tuesday with an opening ceremony featuring William Puckett, who told the story of New York City firefighter Stephen Siller, for whom the foundation was started.
Folks, I can't tell you what it really means to me to be able to do this. To be able to travel the country, to educate our youth, but to also tell the story of Stephen Siller and to talk about this great foundation. Because the one thing I say to everyone is, out of tragedy, at some point, something good will happen. Now, it may not be the next day, week, month, year, but something good will happen. And out of that horrendous day came this foundation. That dreadful morning, Stephen Siller had gotten off ship. He was on his way home. He was going to meet his brothers to play golf that afternoon. And he only got 3 or 4 miles from the firehouse when the North Tower was attacked. He turned around, came back. He was on Squad 1. That's in Brooklyn. When Stephen got there, the squad, they were already dispatched. So he grabbed his gear, put it in his truck. He was driving to the towers. And of course, to go from Brooklyn to Lower Manhattan, you have to go through the Brooklyn Battery Tunnel. And when Stephen got to the mouth of the tunnel, it was closed. He got out, put his bunker gear on, and he ran 3.5 miles through the tunnel to meet his squad at the South Tower. Unfortunately, when the tower collapsed, they all perished that day. The real sad part, folks, that Stephen's remains will never recover.
Ceremony also included tributes to Quincy natives Kevin Connors, who worked in the World Trade Center, and Susan McKay, who was on board American Airlines Flight 11. The 83-foot tractor trailer includes steel beams from the World Trade Center, documentary videos and recordings of first responder radio transmissions that day. Tours of the exhibit are given by New York City firefighters who responded to the attacks. The exhibit will be open through tomorrow. It's our check of news for you today. Coming up, we chat with Kentia Torres of the Social Security Administration. That's next. Welcome back. It has been over a year, actually, since we last chatted with Kentia Torres of the Social Security Administration, so it's long overdue for an update. She's joining us virtually today to do just that. And good to see you again, Kentia. Thanks for spending some time with us.
Good to see you too. Thank you for inviting Social Security today to speak on Social Security updates.
Yeah, it's our pleasure. It's something that affects everyone at some point in their lives, dealing with the Social Security Administration. So it's always a good way to keep in touch with any updates and any changes that folks should be aware of. Why don't we just start with kind of, I guess, a real general overview, Kentia. What is Social Security?
Well, Social Security is pretty much a foundation of retirement benefits. It was created in the 1930s to give us a safety net for retirement. But now we also pay disability benefits, either Social Security Disability or SSI, which is a supplement for those people who have low income and resources, who may be disabled, blind, or 65 and older. So it's pretty much something that we pay into as we work, so that if we become disabled or we retire or pass away, we have those benefits available.
And does everyone have a Social Security number?
Well, not everyone, but most U.S. citizens have a Social Security number, permanent residents, some students. So most of the population have a Social Security number. So when we work, that Social Security number is used to track our work throughout our working lives, and that is how we pay into Social Security.
Sure. Obviously, since the pandemic hit, there's been a lot of changes to the administration. One of them is the fact that we're still communicating virtually.
Virtually.
Because we have some workforce reductions, I know. But any lasting pandemic era changes that folks should be aware of in Social Security?
Well, right now we are reopened to the public, but business practices have changed a little bit post-COVID. I know before COVID, we had a huge traffic in the offices, and most people prefer to come into the office to conduct all their business. But after COVID-19, many of our staff are still, half of them are in their houses doing virtual work, and the other half are in office. So although we are open to the public, we highly recommend that before you come into the Social Security office to apply for benefits, that you call us and schedule an appointment, so that, again, we keep the waiting rooms a lot clearer, but we're able to have the person available to assist you with that application. Because if you walk in, we can't determine how many associates we're actually going to have ready for you and all the questions in the office. But of course, everyone's able to walk in. What we will do at that point is respond to as many questions as we can. And then if you need an appointment, we will schedule an appointment either in office or over the phone. But the best way to apply for benefits at the time is online. By completing let's say, if you go to socialsecurity.gov, it takes about 10 minutes to complete a Medicare application and about a half an hour or so to get a retirement application in. And so what I like to remind people is the questions that we will ask you are going to be the same questions that you will get online, right? What is your date of birth? Have you ever been married? These are answers that only you will have. And we have gotten a lot of great feedback when people apply online, because they're able to take their time. You get a re-entry code when you apply online. So if you're unable to complete the application all in one sitting, you can walk away and come back another time, get your filing cabinet and all your documents. And so people say that they feel a lot less overwhelmed. And we notice that the quality of the information is a lot greater when people apply online. But not only that, when you apply online, let's say for retirement, when we get those applications here in the office, it is assigned to a claim specialist, and that person should be contacting you, I would say, within a week or two to review your application. And what we see is that if you actually schedule an appointment, you may have to wait about 2 to 3 months just because we're saturated over the phone. And if you apply online, you could actually get your benefits a lot sooner, within weeks, in your bank account, instead of waiting months for that appointment in the future.
Yeah, it's a great point for sure. And I know that the website has been updated, improved, and expanded. You can do just about anything that you need to do with Social Security through that website. But what can't you do, Kentia?
All right, so let's say if you are, let's say, a child to apply for SSI, usually that we will have to schedule an in-office or telephone appointment. Another thing is if you, let's say, recently just got married and you want to replace your social security card, usually we're able to replace social security cards if it's a quick change, like let's say you need to just, if it's a simple transaction, there's no changes that need to be made, you're a U.S. citizen, or everything has been established, that you should be able to do online. But if you have, let's say, a name change, or you're getting an original first-time social security card, let's say you're a student from another country or you have a special visa, those are the type of applications that you will most likely will have to come into the office to complete the process. So we will still take your application, and I give you about 45 days to bring the documentation to complete the request for a social security card. But like you said, many things are actually available online, such as replacing a Medicare card. And I mentioned that because open enrollment is coming around the corner.
Yes.
To replace a 1099 if you get social security benefits. Also, what I wanted to mention is by creating a My Social Security account on socialsecurity.gov, you will be able to have access to your Social Security information, whether you receive benefits or not. It's pretty much a gateway for you to stay informed with your Social Security record. So you'll be able to have access to your work history. You'll be able to get estimates on current and future benefits, even if you're not close to retirement. And what I say is, a Social Security account is for everyone. If you're working at any age, we always recommend that you look at your earning history at least once a year so that you are sure that you're getting credit for all the work that you're doing. You do not want to wait until you're close to retirement age to learn that you're missing wages in your Social Security report. And so, again, it is an easy and safe way to conduct business with Social Security. Anywhere in the world, you can opt to get all your letters in that account and get a text anytime we send you any information, so that you don't have to wait for snail mail, especially if you're planning to travel once you retire. So there's a lot of great features with creating My Social Security account on socialsecurity.gov.
Yeah, it's a great point. And another one too is it's a good safety net, right? I mean, if you create your own account, it means somebody else can't do that in your name, right?
Correct. So we ask a lot of security questions so that we can safeguard your information. And you get, in addition to all the questions, you get a text message. And right now we're using login.gov and ID.me to also give an extra layer of protection on your information so that, we know that you are who you say you are whenever you log in. And correct, if you create your account, no one else will be able to create that account because you have pretty much lock down that information by creating your own username and password.
One thing you don't do anymore, Kenty, is accept faxes, talking about old technology,
yes.
Right?
Right. So I'm glad that you mentioned that. So yes, recently we stopped receiving fax paper applications. Prior to or during the pandemic, we accepted fax applications because of the situation at the time, and our offices were closed to the public. But after May of 2023, where the COVID-19 restrictions were lifted, we are now reopened to the public. And so now you may still fax the applications, but what that's going to give you is just protective filing, which is the date that we use to determine as of when we should start paying you benefits if you are approved. So if you have that, of course, fax it. But the best way is, again, to apply online so that you complete the application, or to call us for an appointment.
Okay, and I'm glad you mentioned Medicare because, as you mentioned, the open enrollment period is coming up. So what does that mean, and what do folks do about that?
Yeah, so we always recommend, especially if you are in the initial enrollment period, which is 3 months before you turn 65, the month you turn 65, or 3 months after you turn 65, is to contact Social Security to apply for Medicare. The open enrollment this year starts from October 15th through December 7th. And this is important for those who want Medicare, but also who want to make a change in Medicare, since we have the Medicare original plan, and then we have the Medicare Advantage. So with the original Medicare, you're able to have Medicare A and B, and then you have the option to add a Medicare prescription drug plan, which is the D, and a Medicare Advantage plan to help you pay for anything that Medicare A and B doesn't cover. With the Medicare Advantage, you're able to have the Medicare A and B, but it also automatically brings the prescription drug plan and anything else that you may need. Now, the original Medicare is a little bit more expensive than the Advantage, but with the original Medicare, you have the option to not stay with a network. You can travel anywhere in the United States, and this may be beneficial for those who want to perhaps go down south in the winter and come back in the spring up north. That is a great plan for someone in that situation. But someone who decides, oh, I'm going to stay in Massachusetts, I may not need that option, they may enroll in the Medicare Advantage, which is a little bit more cost effective, but you do have to stay with a network. If you choose one or the other and you decide it may not be the best fit this year, you may change that during open enrollment, which again is from October 5th through December 7th of 2023.
I'm sorry, go ahead. Yep.
I also wanted to mention that if you have Medicare Part A and you want to add Medicare Part B only, and you fall under the special enrollment period, which is for those who did not need Medicare during the initial enrollment period because they were either still working and covered under their group health plan, or their spouse was covered under a group health plan and they were covered that way. So they didn't need Medicare Part B. So if you fall under the special enrollment period, you will need to submit 2 forms to Social Security. One of them is an application to Social Security saying, yes, I want Medicare Part B. And that is the CMS 40, which you could actually download on socialsecurity.gov. And you will need to see the employment information to verify that, in fact, you were covered under group health plan. And that is the CMS 564. Once we receive those 2 forms that you, again, may download on socialsecurity.gov, we will process your request. And you should get your Medicare card within 2 weeks in your house. So very important information to learn, just because Medicare is around the corner and we don't want you to miss your enrollment period.
Absolutely. Yeah, that's what I wanted to ask, is if you do miss the enrollment period, Kintia, do you have to wait till the next enrollment period the following year, or can you go back?
Well, great question. So if you are no longer eligible to your initial enrollment period and you do not qualify for what we call SEP, the special enrollment period, you still have another chance during the general enrollment period. And that period begins every year from January 1st to March 31st to allow you to enroll in Medicare. And it used to be last year that if you did not have Medicare Part B, you would have to wait till July of that year to get Medicare Part B. But now that changed. In 2023, you wouldn't have to wait till July. Your Medicare Part B will start the following month after you apply for Medicare.
Okay.
Now, what hasn't changed is the fact that if you decide, you know what, I do not need medical Part B, I am fine, I'm healthy, I don't even see a doctor, and later on in life, you do need Medicare, and you did not enroll in Medicare, either Part A or B, you may have a 10% penalty for every year you did not enroll in Medicare Part B.
Yes.
So that has not changed.
Okay.
And it is important to know. But if you need additional information because maybe you're confused or you want to verify what your enrollment period is, feel free to call Medicare at 1-800-633-4227. Again, 1-800-633-4227. Or you may call Social Security at 1-800-772-1213. And we're open at the call center from 8 a.m. to 7 p.m. local time. So you may call us and verify to see if you may qualify for a special enrollment period, so that way you don't have to pay for Medicare and your insurance at work.
Okay, it's
So,
really
yeah.
important. And do you recommend also folks visit the SHINE program in their respective communities to get counseling on Medicare?
Yeah, so SHINE, we actually work along with SHINE. We refer people to SHINE all the time, and SHINE will assist you. It helps those who are eligible for Medicare decide if they need a Part B, but most importantly, which prescription drug plan they may need. Because here at Social Security, many people believe that we do everything with Medicare because we enroll you, but all we do here at Social Security with Medicare is enroll you, withdraw you if you're not interested, and also help you pay for the, let's say, take the premiums so that we can send it to Medicare. But if you have any questions regarding Medicare Part D, that would be private insurance. So we wouldn't be able to guide you in the right direction when it comes to that. Or if you have any questions regarding coverage or copay, those are questions that would go directly to Medicare or the SHINE program. And what I always recommend is to visit a website, SHINE, and you will see which phone number actually belongs to your zip code. And those people are phenomenal. They're gurus when it comes to Medicare and the different parts of Medicare.
Yes, yeah. And I know you as well, Kentia, are available to go out and talk to different groups about Social Security, correct?
That is correct. So Social Security provides presentations to organizations, companies, agencies, even schools, and these are free of charge to the public. So we are now offering, and we have been offering actually for a while, free Social Security presentations, whether it's retirement, disability presentations. We also speak about Medicare, and we're now, presenting on all these benefits because we want to inform the public of what is available at Social Security. We want to make sure that you get your information and that you're prepared, either if you are ready for retirement or getting close to retirement. But I often see many people who ask me, like, am I eligible for Social Security disability? Well, there's a great way to see how Social Security works and also allow you to decide if it's the best option for you now, if you're working, what are the limits. So I am currently available, and many of us all over the state of Massachusetts or in another state. You may email me at Kentia, Kentia.Torres, Torres, at ssa.gov. Or you could call 1-800-772-1213, and they will refer you to me so that I could contact your organization and schedule a presentation.
Thank you so much, Kentia. Great to talk to you today. We hope to see you in Quincy real soon.
Thank you very much for everything. Thank you for inviting Social Security today.
You are very welcome. Just enough time to check the forecast for you for the rest of the day today. Get out and enjoy it, because after this it heads downhill. We've got sun and clouds, upper 60s today. It looks like a wet weekend, unfortunately. Tomorrow off and on rain and showers. Same thing Sunday, and Monday is gray as well. Thanks again going out to Kentia Torres for joining us today from Social Security. Thank you to our crew, and thank you for watching. Monday here in the show, we'll learn about efforts to create the President's Coast Walking Trail in Quincy. Meantime, check our website, qatv.org. You'll find our latest programs, news and information, video on demand, live streaming, and more. For all of us here at QATV, I'm Joe Catalano. Have a great weekend.